A CDC panel set to meet tomorrow to discuss authorizing a third vaccine dose for people with compromised immune systems. This as HHS reports the agency will mandate vaccines for roughly 25,000 healthcare workers. It applies to federal contractors, volunteers, and people training. Earlier today, the nation's largest teachers union announced it now supports policies that require all teachers to either get vaccinated or get tested regularly. In Mississippi, several schools have already been forced to switch to remote learning as COVID cases and hospitalizations spike across the state. Officials there just asked the Biden administration to send a military hospital ship, the USNS Comfort, to take pressure off the state's overwhelmed healthcare system. A doctor there now warning it's on the brink of collapse.
The rate of the testing positives and then the rate of hospitalizations based on what we are seeing, if we continue that trajectory within the next 5 to 7 to 10 days, I think we're going to see failure of the hospital system in Mississippi.
Let's bring in Dr. Ijlal Babar now, critical care director at Singing River Health in Ocean Springs, Mississippi. Doctor, thanks. That is a grim warning that your state's healthcare system could fail in a matter of days. What are you seeing in your hospital? What are you hearing from doctors and nurses in your neighborhood, your area, your state? How bad is it?
It's pretty bad, Tyler. We're stretched to capacity right now. Our ICU beds are full. We're having to board a significant number of patients in the ER. Our morale is flagging, especially the nurses who are at the bedside all the time and the respiratory therapists. So it's a worse situation than it was last year.
Are the patients sicker with this new virus than with the earlier strains of COVID?
So one difference, of course, is that these are younger patients. Mm-hmm. The average age is below 50. Their lungs are as sick or sicker than they were in the previous surges. But what we're not seeing as much of is multi-organ failure. So last year we were seeing people's kidneys and livers collapsing, and we're not seeing that this time. So the lungs are terrible.
Very interesting. You said, pardon me, you said that you're seeing younger patients in general. What about children? We're hearing that children are coming down with this disease in greater numbers. Have you seen that?
So we don't directly take care of children, but there are a significant number of children at UMC who are on the ventilators. We don't have that facility in this hospital, so I can't give you our own data.
Data shows that the majority of patients coming into the hospitals are unvaccinated. What kinds of conversations do you have with them?
So when these people are in the ICU, that is not the time we can have this conversation. Mm-hmm. The time we have this conversation, I personally have this conversation, is when I see them in the clinic, in the setting where I can influence them. And there are times where I hit complete roadblocks. I've been told by one patient, one very young patient, that she would rather die than get the vaccine. So that's what we see.
Are you seeing vaccinated patients in the hospital?
Very few. If we do see them, they are either going to be there for a different reason, that they might have mild COVID but are in the ICU for a different problem, or else if they do end up in the ICU, they do fine. No one has needed to be on a ventilator, and almost everybody gets discharged.
Quickly, what do you want the country to know right now, tonight?
I think what I'd like the country to know is that we're stretched to breaking point, that we need help, and we need help more than anything else with retaining nursing staff. There's a national nursing shortage, but it is especially a problem down here.
Dr. Babar, thank you very much for your insights tonight. We appreciate it. And nearly 2 weeks after Lollapalooza, one of America's largest public events since the pandemic began, Chicago's top doctor delivered this message today.
We've had no unexpected findings at this point. There's no evidence at this point of a super spreader event, and there's no evidence of substantial impact to Chicago's COVID epidemiology.
Essentially, then, a success story. Organizers gave people two options: either show proof of vaccination or a negative COVID test. The massive crowds tested Chicago's COVID safety measures, and the data shows they worked. In total, about 385,000 people attended the four-day outdoor event. City health officials say around 90% were vaccinated. They predicted there would be around 200 COVID cases linked to Lollapalooza. It turns out there were 203, 76 among unvaccinated concert goers, 127 among the vaccinated. But keep in mind, the majority of the attendees were, in fact, vaccinated. Most importantly, there have been no hospitalizations and no deaths connected to the event so far.